Is it okay to just wear one hearing device if I have hearing loss in both ears?
Well, the short answer to that is probably not. It's usually appropriate to wear 2 hearing aids if you have hearing loss in both ears. But like most things, it's a little bit nuanced. There's some exceptions to that rule.
If you try to see with one eye, you can do a pretty good job. But it turns out with 2 eyes, you can see twice as far and twice as clear.
And you get the depth perception,
Does that happen with our ears?
You know, that's a really good question. And yeah, you know, having 2 eyes is important for our vision.
Yep.
And it turns out having 2 ears is important to our hearing. Having 2 ears obviously is beneficial. And if you've got hearing loss in both ears and you correct just for one side, it's going to make sound all sound like it's coming from that side. So it can really play with some of your ability to localize sound.
That's right.
You know, the phone rings over here, but you've got your hearing aid here, so you're looking to the wrong side.
Right. So we have localization issues that if you have hearing loss in 2 ears and you only correct one, you oftentimes will localize to the sound where it just sounds louder. So why wouldn't you localize to that side? The second part to this that's interesting is the ear, when we stimulate the ear on both sides, it's putting information up into our brainstem. And physiologically, our anatomy works with our brain, and the way we're wired is for 2 ears. The way our brain receives the best signal through the auditory system is not from one side or the other. In other words, it's not a linear stimulation. What happens with sound is it comes in this ear, and it actually heads to the brainstem. And at the brainstem level, the 2 signals summate, or they add together. And they call it the summation effect. And so, in essence, when you have sound that's appropriate from both sides and it comes in, that signal adds together and it becomes 2 times as strong, 2 times as sharp, 2 times better. And so we, in essence, have a much better signal just because we've got both ears involved.
That's right, yeah. As sound travels up through our brainstem, up towards our brain, there's some crossover back and forth, and our bodies are just designed to have 2 ears. It works better.
2 ears engaged, yeah.
And you know, a little less technical, when I try this with patients, and we do sometimes patients will say, let's just try it, let's just see what happens. Right. They often will say, you know what, I do just feel really lopsided. I just feel like, boy, everything's over here. Yeah. And so it almost creates this heavy effect of, wow, I really feel like I just need to be balanced back out and get sound on the other side again.
That's true. You know, another interesting thing to this is that if you go through life with 5 to 10 years of just stimulating one ear only, and you don't stimulate the other side, you do have an atrophy effect. And so that ear that's not receiving attention, not getting the stimulation, not receiving the proper neural energy over that same, time span, it will atrophy, and it'll not become dumb, but it's just not as sensitive to sound. It's not the awareness, the details that go on in getting a signal from your ear up to the brain. It kind of becomes cloudy. You know, when you're out, walking or hiking, or you're on that side by side and you're cruising along, and all of a sudden you see a trail, and you look over at this trail, and it looks like there's bushes and weeds and vegetation that's kind of grown over. You can tell it's a trail, and it used to be a nice trail maybe, but then you look over here and this trail has 2 really nicely defined, markings where your tires should be. It's very obvious that this trail is clean and nice, and you know what? I think I'm going to choose that trail. Well, that kind of happens to us. If we don't stimulate frequently and often, and we don't get the right energy on our nerve, it does become weaker. It does become less traveled. It does become less efficient.
You don't want an overgrown ear. Nobody wants the overgrown ear.
Yeah.
No, you want the well-manicured, well-maintained.
The nice pathway.
Nice pathway.
If I'm going on a hike, I want the nice pathway.
That's what I'm saying. Yeah, but obviously that's true. This auditory deprivation is not good. Most of what we hear is transmitted through nerves. It's a neural process to be able to hear. So it's not exactly like a muscle, but the analogy is good in that if you're not exercising these neural pathways, they're going to get overgrown and they're going to get weak.
One other quick thing is that when you stimulate with both ears, Dr. Whitaker mentioned that in the brainstem, the signals cross. and then they go back, and then they cross again. And there's this cross-checking of the signal that helps us with loudness perception. It helps us with background noises or more dynamic type signals. Certainly helps us with timing cues for localizing to where sound can go. This crossing and cross-check system helps I kind of think of it like it cleans the signal up, and it makes it easier, more understandable, definitely more effective for not only localizing to sound, but understanding speech in some of the more dynamic listening environments. So we are big fans of, if you have an issue with two ears, then you should help both ears.
Binaural. However, like most things, there are exceptions.
That's right.
So maybe we'll discuss one or two exceptions on when maybe you would just wear one hearing aid. One example might be that you have hearing loss in both ears, but one of the ears has such a profound hearing loss. Essentially, one ear is deaf. Mm-hmm. And in a case like that, you might just amplify the other side, because it is possible to have such profound hearing loss that a hearing aid no longer is of much help.
And then, of course, the contrary, or the opposite of what he's talking about, is if someone has normal hearing. So you can have totally normal hearing on one ear, and the other side, maybe you had a viral infection and it took your hearing, and you know, your hearing's terrible on one side and it was a sudden thing. Or maybe you're a gun shooter and you have one ear that is quite good, you know, basically normal, and the other ear is way worse. There's all kinds of accidents that people have, from loud, high amplitude sounds on one side to infections, wax, you know, different things like that. So there are reasons why someone should just wear one, but by and large, the majority of the people we see, where their head goes, both ears go, and so there's hearing loss on both sides, and in that case, both ears need to be treated.
Yes, almost always both ears need to be treated. Maybe just to piggyback a little bit on one thing you said, sometimes people do get an infection of their inner ear. Mm-hmm. Sometimes that infection affects the auditory nerve. Mm-hmm. And it is possible to have an ear that still has some hearing. You're not deaf in that ear, but it processes so poorly, right, and the sound is so distorted that when you put a hearing aid in that ear, it actually distracts. And
Makes
so you
it worse.
put on two hearing aids, but this one side is so garbled and so distorted because the nerve is so affected that there are people occasionally that can't tolerate that. And so we'll take away the one and just amplify the other side, and they'll say, oh, that is a lot better. So these are exceptions. These happen on rare occasion from time to time. But the answer to the question, boy, if I've got hearing loss in both ears, should I have two hearing aids? It's almost always yes.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.